So acute heart failure happens when happens due to some anatomical, maybe functional injury of the heart, and in a situation when there is no enough time for compensation, for compensatory mechanism to appear. And of course, acute heart failure, when heart is not ready for it, for some injury, of course, it is accompanied with very severe symptoms. If it is a left-sided heart failure, acute, it's a pulmonary edema and cardiac asthma, or even hyperperfusion due to cardiogenic shock. Of course, acute heart failure, as you can guess, could be subdivided on left and right-sided, as chronic as well. Chronic heart failure is the most common type of heart failure, and it is due to chronic injury. So when a patient has some chronic problem, for example, left ventricle hypertrophy, or maybe right ventricle hypertrophy, dilation, aneurysm, so something that when patient has some chronic pathological process which underlines heart failure. Symptoms and signs of congestive heart failure. Congestive heart failure is an old term, okay? So it's a very usual term, usual word to describe heart failure, both-sided, I mean, biventricle heart failure. But now, so it is not used according to the opinion of a cardiologist. Okay, but this term is very good to remember what happens. So because congestion means staying of water inside different part of our body due to not appropriate systolic function of their ventricles. Here a good picture that describes this, and you can see. So here just a list of symptoms, and I will try to explain you why and when any symptoms appear in a patient. You can see this patient with a lot of pillow behind the back. It's a symptom arthropnea. You can see a patient with dyspnea, of course, arthropnea. When you put a stethoscope, you will hear crackles, fine crackles in the lower part of their lungs. It is due to congestion of the blood, due to left-sided heart failure, because the left ventricle is not able to get all the blood from the lungs, and this blood stays in it and lead to pulmonary hypertension, of course, finally. Any other symptoms, ascites, edema, decreased urine output. So you can see, so it's not very good condition, of course. A lot of signs and symptoms which influence a lot on patient life. Okay, left ventricle heart failure. Symptoms and signs that we have in this patient result from progressive damming of blood within the pulmonary circulation, and so the first point, and the second, diminished peripheral blood flow, so hyperperfusion of the organs. So we could have patient only with this, or we can have patient with this and with this as well. So when patient has hyperperfusion, it means systolic dysfunction, and of course it's not very good. Systolic left ventricle dysfunction. Okay, here pathogenesis of pulmonary edema, and you can see here it's not obligatory to have, as you remember, to have a dilated left ventricle. It could be hypertrophy of left ventricle, restrictive type. It's a diastolic dysfunction when left ventricle, which is with hypertrophy, could not appropriately relax. It will increase the blood pressure and diastolic volume here, and finally here. And of course, it would lead to congestion and staying of the water inside lung interstitium, and then transduction of this the water into the alveoli. That's why you hear crackles. And clinically, we can guess that patient has left ventricle failure if he has symptoms, dyspnea. So of course, if left ventricle has diastolic dysfunction or systolic dysfunction, and patient has this congestion of the blood in the lungs, of course it will lead, do you remember, to the irritation of J receptors, which are located in pulmonary interstitium, and it would lead to dyspnea. This dyspnea could be different in its intensity, so it could be mild, severe, moderate dyspnea, and usually it appears when the patient has some physical activity. So at rest, this dyspnea could disappear. If you see the patient with dyspnea in rest, it means something serious happens. Heart failure, respiratory failure, anything else. But if your patient has dyspnea at rest, it's something critical. So it means severe functional abnormality due to any organ damage. Here we are about heart, that's why heart damage, heart failure. Okay, paroxysmal nocturnal dyspnea and arrhythmia. So it's symptoms that we discuss. Again, the idea is that when patient is upright, their venous return the venous return to the right ventricle is decreased. It means that less blood here, less return, less blood in right ventricle. It means that less blood inside their lungs. If less blood inside the lungs, of course, less congestion. Less congestion, less dyspnea. So idea of arrhythmia is like this. That's why patients prefer to have a lot of pillow or to sleep in this position, a little bit uprighted. To bindapnea, it is when patient so climbing forward to make something with the shoes and so on. Again, it is because of redistribution of the blood and increase of the blood in the lungs. Of course, this increase leads to increase in congestion. Coughing, the same idea. So when congestion is very severe and even not only serum but also red blood cells go to their alveoli, it could lead to coughing with hemoptysis. Fatigue, as you remember, is a general symptom which is not specific. It is not only in heart failure, but of course in patients with heart failure due to bad not appropriate perfusion or not appropriate oxygenation of the blood. Of course, every cell in the body suffers from hypoxia, and this, of course, lead to fatigue. Muscles, all other organs. So patient describe it like this symptom. Signs, general exam. So tachypnea, arrhythmia, acrocyanosis. Idea of the acrocyanosis in left ventricle heart failure, it is bad perfusion. So left ventricle is not able to perfuse, to pump a lot of blood to the circulation, and it means that distal parts of the body will have venous blood. So because of this bad perfusion, and we can see it as acrocyanosis. Acrocyanosis, by the way, it's not specific for left ventricle dysfunction. It could be in any other conditions. For example, when it is very cold. In general examination, of course, it's a exhausted patient with facies cervizarii, as you can remember. What we can find when we start palpation, percussion, and auscultation of the heart. Palpation, we can find signs of left ventricle dilation or left ventricle hypertrophy. So, because left ventricle dilation will give us, as you can guess, systolic dysfunction, and left ventricle hypertrophy will give us diastolic dysfunction. And diastolic dysfunction is, as you remember, is just bad relaxation, and it would lead to dyspnea. Yes, dyspnea during physical activity, but I must say that it is only one symptom of the most common and sometimes only one symptom in patients with diastolic left ventricle dysfunction. But we can find these features, dilation and hypertrophy by palpation. Decrease in systolic dysfunction. So when the pumping function of the heart is decreased, arterial pulse filling will be decreased also. Tachycardia. Tachycardia is an attempt to compensate bad perfusion. So low cardiac output, and of course, if it is low, we need to increase heart rate for appropriate perfusion. Pulsus alternans in severe heart failure, in severe systolic left ventricle dysfunction. It is when, do you remember, it is when one systole is normal, the next one is very low. The next is normal, the next is very weak. Normal, weak, so alternance. So when they change, because of systolic dysfunction. So idea is for the one systole, left ventricle could do something, but for the next, no forces. It had to have some rest, and that's why weak contraction. Percussion, the same signs of left ventricle and the left atrium dilation and hypertrophy. Left atrium is dilated very often in left ventricle hypertrophy. Auscultation. So, of course, S1 is usually diminished. Why? Because do you remember components of S1 is a muscle component and valve component, and be honestly, no one is good in the situation of left ventricle dysfunction because something wrong with the left ventricle or with valve or both. That's why, of course, S1 is diminished, and we can find P2 accent due to pulmonary hypertension in this patient. So P2 accent, increased pressure due to this congestion in the pulmonary artery, and P2 accent. Sometimes when left ventricle is dilated, we can find protodiastolic additional sound. It sounds 3 and gallop rhythm. So when we have 3 sounds, first, second, and third, and it has name gallop. So because of their horse running style. And the lungs, as I already said, it will be crackles, but not only crackles. I must say that decrease. First of all, we should evaluate breath sound, and it could be vesicular, bronchovesicular, bronchial, If it is vesicular, it could be diminished or increased, and sometimes in patients with pulmonary congestion, we hear decrease of their vesicular breath sound in the lower part of the lungs due to this congestion. And in the same place, both sided, of course, we would hear crackles or fine crackles.